Still talking about those NHS strikes, what's happened last week and previously. The junior doctor strike last week, we learned that more than 196,000 hospital appointments had to be cancelled because of that strike in England last week, include people waiting for operations and other treatments, as well as scans, follow-up appointments. It's the largest number of cancellations so far in the NHS pay dispute because it was a 4-day strike. And, of course, coming out of the Easter weekend as well. Some hospitals, though, reported not carrying out up to half of their planned work. So consultants who would normally do that work, who weren't on strike, could be deployed to emergency care to cover for striking junior doctors. We also are seeing, of course, future strikes coming up. We're still waiting for ballots from various different unions on what they will do and whether or not those are going to be unofficially coordinated at the end of this month. Let's talk about all of this with Onkar Sahota, who's an NHS GP and also a Labour member of the London Assembly. Good morning to you, Onkar.
Good morning, Julia.
Thank you very much indeed for joining us. Incredible, devastating effects on individual patients of these strikes. Do you believe it's justified?
I think you're absolutely right that, look, that this has had a tremendous effect. But, of course, the doctors are fighting on behalf of the NHS. These patients, we already have long waiting lists, over 7 million, and the doctors are tired. They're not able to give the service they want to give, and they're highlighting a problem in the NHS. So I think the justification is that the doctors are tired, they're working hard, and they're not giving the care they want to give to their patients. So they are fighting on behalf of the doctor. And I speak as a GP, and I speak as a father of a junior doctor.
OK, I don't know how GPs are tired since you could barely get an appointment with them. And look, junior doctors, no doubt at all. I remember the hours my mum worked when she was a junior doctor, very, very long hours. I've got no issue with highly trained, highly educated doctors earning a very good wage. And of course they earn more than the average. Well, they should do. It would be bizarre if they didn't. However, talk of the next junior doctors' strike going ahead and actually withdrawing care from emergency services, from vital cancer care, maternity care and the like. There's no doubt at all that that will 100% mean that people die. Patients will die as a result. How can doctors claim that they're doing this for the NHS and for patients if they will actually go so far that they will withdraw care from emergencies?
Okay, Julia, let me tell you, the reason you can't get an appointment with your GP is because there aren't enough GPs in the system. The reason people are already dying because there aren't enough doctors and nurses on the wards. There aren't enough doctors and nurses to get the care patients need.
No, it's not just that. It's because the NHS shut down for 6 months in 2020.
You can't blame everything.
I didn't blame.
On the COVID, Julia. There were problems.
I'm not blaming it on COVID. Locked out the policy. The NHS closed down for 6 months to pretty much everything other than COVID. That was a deliberate policy choice. Other countries didn't do that and not face the same problem. There were already massive delays. This has made in care. This has made it much worse.
Of course. So we can't skip the fact that we had problems in the NHS pre-COVID, and that we also are still continuing to have the problem. So we have the shortest number of doctors, ratio of doctors and nurses to the population.
We do.
The lowest number of beds to the population. So I think that we can't say that the NHS has been working perfectly until
no one's pretending that. But I mean, the BMA, which is the Junior Doctors Union, they quite happily, in about, was it 2008 or 2009, basically lobbied the government for having a limit on the number of medical school places there would be for students other than UK students, not overseas students. So we've actually deliberately curtailed. I mean, the government were crazy to agree to it and to enforce it. And I blame it was a Labour government and then a Tory government. Equally, a plague on all their houses. Limiting the number of doctors who can train. Yes, it's 250,000 to train a doctor. We don't want to just train 1 million doctors we don't need. But the deliberate policy. Then we had to import a load of doctors. And now we face a doctor shortage. I mean, this has been an entirely created problem.
Well, I agree with you entirely that last year we had more international medical graduates joining the GMC than UK graduates, and so we're a net importer of doctors from overseas. And because those doctors are in the training grades, the junior doctors who aren't skilled and trained the way we want them to work in this country. So we have a big issue here. And you're absolutely right. Why do we have a shortage of doctors, nurses, maternity, midwives, psychiatric nurses? In every branch of the NHS, we have a shortage of staff. And I think we need to talk about what's causing them stress, what's the workload, and how do we get them to be really motivated to work for the NHS?
I mean, pay and condition, there's no doubt at all these are absolutely crucial. But At a time when we are in absolute crisis in our healthcare, when people are quite literally dying, excess deaths are very, very high. Before the junior doctor strike, there's some evidence that suggests that over that period, we don't know how much of it's down to the junior doctors' first strike, but the excess deaths trebled in that period. But hundreds of people are dying who would not normally be dying because they haven't been able to get treatment. They didn't go to a doctor soon enough. They couldn't get an appointment soon enough. They weren't referred soon enough. They didn't get treated in A&E soon enough. Couldn't get an ambulance. All the different reasons. Is it, as much as I can understand and sympathise with doctors who've seen a real Tums pay cut, and I think should probably be paid more anyway, is this the right time for doctors to be striking?
There's never a right time for doctors and nurses to strike. There's never a right time for that, Julia. I think what we really need to do is get them to also sit down without any preconditions and have a discussion with the government. The government should be honest to resolve this, and let's have ultimately, people will suffer are the patients. And I agree with you entirely that we need them to sit down without any preconditions and have a discussion how to resolve this matter.
Is it reasonable for the Health Secretary, Stephen Barclay, to say there must not be another strike on the cards? You should suspend your strike action while we talk. Is that a reasonable? Because that is a precondition that the Health Secretary is putting.
I think that moment probably has been lost, right? That we could have done this a long time ago. He keeps quoting about 35% pay rise. I think what he should say is, let's sit down and talk and say, how do we prevent the next strike? I think there should be no condition on the table.
OK, thank you very much.
I think if the Secretary of State really wants to resolve this, and doctors want to resolve this, sit down without any preconditions and let's have a discussion of how we resolve this matter.
Thank you. Onkar Sahota, who's an NHS GP and also a Labour member of the London Assembly. Thank you for that.